Hello everybody, this is FES tutorial number 1, Advanced Mucosal Evaluation of the FES tutorial series. Full disclaimer, this is not an exercise that I've incorporated into my practice regimen. However, it is one that I believe the skills that are required are trained through the remaining exercises to the point where perhaps incorporating this particular exercise in one's regular practice routine becomes a little redundant, especially since the skills are covered by exercises such as the advanced endoscopic navigation, advanced targeting, and advanced retroflexion. It is a fundamental exercise and a fundamental skill to be able to navigate the lumen and identify lesions. It is perhaps easier than the remaining exercises. However, it is one that can easily be mastered through an overall understanding of navigation principles, keeping oneself centered in the middle of the screen and identifying any potential suspicious lesions. As with all FES exercises, I recommend that you keep the wheels completely loose because that is closest to the actual patient experience. And that if you're perhaps starting to get familiar with the world of endoscopy, maybe it would be best to have somebody who's a little bit more familiar with the mechanics of scoping so that you can hold the scope and they can hold the wheel and then switch so you can hold the wheel and they can hold the scope. And then by the time you reach your third attempt, perhaps they're going to hand you both instruments and you can fully take over. And that is purely because I myself have not found any logical way to memorize how the scope moves. As mentioned in next videos, there are 3 axes of movement. One is the big wheel, another one is the small wheel, and then of course there's a third axis, which is the rotation of the scope itself close to the orifice. Rotating the scope close to the orifice gives a new function to both your wheels, whereby if you think you've run out of movements, you can just twist the scope and then the wheels do something a little bit different than the last time. Thank you everybody for watching, and I hope you have a great rest of your day.